Hello, my name is Neil Skipper. I'm an agent in the state of Florida, insurance agent that is. Live in Cape Coral, Florida for 37 years. Also am a non-resident agent in the states of Michigan, Ohio, Virginia, South Carolina, and Georgia. So if by chance you are seeing this and you would like some information, please give me a call. My 800 number is 782-4313. In the state of Florida, I have a cell phone that is always with me. It's 239-910-4956. 239-910-4956. Email address is Neil, the number 1, and that's spelled Neil, the number 1, and Skipper, Skipper, at AOL.com. Well, when folks are turning 65, they're wondering what they should do. And I hope I can be of some assistance in this short video. Your options are many. And a lot of folks, if they're working, they may not want to participate in Medicare, especially since Part B has a premium of $99 or so this year. So if you have a good insurance at work, and your premium is not a whole lot on that, you may want to stay where you are. Now, if you're taking Social Security, you will automatically be sent a Medicare card with A and B, effective for your birthday month. And you may reject that if you like. You keep Part A and reject the B part. Now, if you're 44 and if you're 64 and 44, that would be nice, right? If you're 64 and just 9 months, you can apply for your Social Security Part A and B. Talk to your Social Security office or go to Medicare.gov and get that started. It is necessary to have A and B to have a supplement. And a supplement, of course, is the called Medigap also. I would like to show you 2 or 3 books that you can gain some information from. Of course, the first one is Medicare and You book, put out by the government, and that will tell you all the nitty-gritty about Medicare. And in the back of that book, if one is sent to you, of course, they will have your zip code, and so they know where area you are in. In the back of that book, we'll have companies that sell the Part D and also the Medicare Advantage Part C. So it's a good little book to have to get some basic information. And like I say, you can go to Medicare.gov and get that. You can read it online or order one or go down to your local Social Security office and you can get one there. The other book is the 2012 book that, of course, is available for 2012. It's Choosing a Medigap Policy, put out by the National Insurance Commissioners and also the CMS, Centers for Medicare and Medicaid, the government, so to speak. And this book deals mainly with the Medigap, or what we call Medicare supplements. As you know, these Medicare supplements take care of the 20% that the Medicare A and B does not take care of. The other book is one put out by one of the best-known companies in the United States, or one of the largest also. And it is a show me guide, and it will get down to the nitty-gritty and give you examples of what would happen if you have chosen certain ways to go. And I suggest both of these books, and I'd be glad to send these to you. The other one, the Medicare and You book, you can get that from the government. But these books here will really give you the information you need. And of course, the little bit of information I tell you here is of course, preliminary, and it does not get down to the situation that you may be in yourself. First, I'd like to start off with the supplements. There are 3 options I suggest to folks in getting a supplement. Of course, supplements have plans, okay, and there are about 10 plans. Some people get plans confused with Part. Of course, there's Part A, B, C, and D. D is the prescription drugs, C is Medicare Advantage, and of course A and B is called Original Medicare. So when you the three options I suggest for a supplement is high deductible Plan F. High deductible Plan F is where you're practically self-insuring yourself because it does have a $2,070 deductible. The premium on that, though, is very nice. It's 30 to 40% of what Plan F would be, and of course you're liable for the first $2,070. So your premium plus the $2,070, if you had a bad year, would somewhere come in the neighborhood of $2,700, $3,000, somewhere in that neighborhood. So that's not a bad way to go, especially if you got the $2,000 lying around. Now, the Plan N is the next one I suggest. This came out in 2010, June, and it has a copay of $20 for an office visit. But the pricing on that is down about 30% of what you would pay for Plan F. So it's not a bad way to go, especially if you're healthy and you're not going to the doctor 10 or 20 times a year. It's not a bad way to go. But Plan F was the better plan of all of the plans. It covers everything that a Medicare plan will cover. And as you know, Plan F with one company is Plan F with another, so it cannot vary. The big thing is, of course, the rates that companies charge, and that's per month, of course. And so you really should look at the rates. Rates can vary $70, $80 between the company. And of course, some can be $50 less or whatever. But the best thing to do is make sure you got the best rate, because you'll be paying for that for a very long time. And of course, once you get locked in with some companies, you may not be able to switch to another company because of your medical condition. So it's best to look at the long term and not just the short term. Now, the Medicare Advantage Plan C, or Part C, excuse me. See, I made a mistake. Called it Plan C. Part C, that's called Medicare Advantage. I'm on that myself. I've been on it for 5 years. And of course, these plans are contracted with the government. Each year they can change. And so your co-insurance, your co-pays, your maximum out of pocket can change each year. And that is one of the unknowns about these plans. Each year they will send you what will be coming up for the next year, so you can decide whether you want to stay on that plan. And you have the month of the middle of October to December 7th to decide if you want to stay on that plan or switch to another plan. And then Medicare Advantage, I call them plans. They're don't get it confused with Medicare supplements. Medicare Advantage plans are not Medigap or Medicare supplements. They are called Part C. But when you say plan, it's a generic term, I suppose. But so what happens, like I said, the government contracts with these companies each year so they can change, and that's an unknown that you'd have to face. And the out-of-pocket max can change, and that's also an unknown. Whether you're going to reach that out-of-pocket max, if your health is good, probability you will not. I call the supplement the Lincoln Town Car, and I call the Medicare Advantage the Pinto. We'd all rather ride in the Lincoln Town Car, but we're going to pay for that. We're going to pay a premium, and that's where your supplement has that monthly premium. A lot of Medicare Advantage plans have either zero or very small premiums, and so you want to check out what kind of premium you have, if you have any. So here again, don't want to bore you with too many things. We could take hours on Medicare options, but you either going to be staying where you are with A and B. That's called Original Medicare. You're going to either have that and a supplement, or you can choose a Medicare Advantage program. And like I say, I'm from good old. I'm not a good old boy, but I grew up in Savannah, around Savannah, Georgia, and so I'm a laid-back kind of guy, and no pressure. I'd like to help folks and see if I could be of some service to them. So if you give me a call or give me an email shout, I'll be glad to get back with you and see if we can be of some service to you. Hey, I thank you very much for watching this video, and hopefully we will meet and talk and we can see if we can be of some service to you. Like again, there again, I say thank you very much, and talk to you later. Bye bye.